Good afternoon. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Welcome to today's webinar on PrEP for World AIDS Day, presented in collaboration with Friends Health Connection. Today is World AIDS Day. Since 1988, organizations around the world have used this day to increase awareness of HIV and AIDS. More than 1.1 million Americans are currently living with HIV, according to the CDC. About 38,000 Americans are diagnosed with HIV each year. Over the past decades, great strides have been made in the treatment and prevention of HIV and AIDS. However, it remains a significant public health issue. During today's webinar, we will learn more about these advances and offer important information about how to protect yourself. We are pleased to be joined today by Shayne Judge, PrEP counselor for Robert Wood Johnson University Hospital Somerset's Siperstein Proud Center. We will begin our webinar with a moderated discussion followed by questions and answers from our audience. So Shayne, thank you so much for joining us today.
Thank you.
So I thought we can maybe start just by having you introduce yourself and tell the audience a little bit about yourself.
Yes, absolutely. Thank you. My name is Shayne Judge. My pronouns are she, her. And again, I am the PrEP counselor for the Siperstein Proud Center for Robert Wood Johnson University Hospital, Somerset. So my role at the Siperstein Proud Center is to work with our PrEP patients. I educate them about PrEP. I run sex education groups every month to help with risk reduction. I offer personalized risk reduction counseling to our patients, and I help connect them with resources for cost sharing and cost assistance to cover the cost of PrEP.
Well, great. And thank you again for joining us. We really appreciate it. So if you can you just give us an overview of what HIV and AIDS are and how it is transmitted?
Sure. So HIV stands for human immunodeficiency virus. And what it is it's a virus that attacks the body's immune system. If left untreated, it progresses into AIDS, which is acquired immunodeficiency disorder or syndrome, And it can only be diagnosed after someone's CD4 cell count drops below 200 cells per millimeter. Now, your CD4 cells are kind of like your fighter cells. They help keep your immune system strong and fight off disease. So we don't want those cells to die. People do not die of AIDS. People die of opportunistic infections that are allowed when your immune system is suppressed. So typically things like pneumonia that you can't fight off once your immune system is functioning at that level. And it is transmitted through blood, semen, vaginal fluids, rectal fluids, and breast milk.
Thank you. Thank you for that explanation. So now, while HIV and AIDS cases have dropped significantly since the height of the AIDS pandemic in the 1980s, it is still a major health concern. So who's most at risk?
So most at risk would be men who have sex with men, particularly among the Black and Latinx community, and IV drug users. And this is not a coincidence. This is due to socioeconomic factors like poverty and racial discrimination. There's stigma and cultural factors that come into play. And there's a high prevalence of STIs in the community, which can put you at greater risk. And again, these are all due to structural inequalities and systemic racism.
Thank you. So now, what are testing options available and who should get tested and how often?
Oh, I love this question. So there are a few different tests for HIV. There are nucleic acid tests, which look for the actual virus, and it requires a blood draw. So it's a little bit more intense, and this is how you can see the viral load or the amount of virus in your blood. And this is an expensive test, and it's typically done only when someone has had an exposure or if there's symptoms present. However, we have antigen and antibody testing, and this is a great modern advancement that we have. These results can come back within as little as 15 minutes. And these test for the antigens in your blood, which is part of the virus, or the antibodies, which is a response to the virus. And so if we see these, it helps us identify if there's HIV in the blood. This is just a small finger prick, usually on your pinky, and it takes about 15 minutes for you to get the results, which is really great. So everyone should get tested. Everyone should get tested at least once a year. I would recommend every 3 months if you're sexually active, It's always great to know your status. Everyone should know your status.
Okay, well, thank you. Now I know, there might be some symptoms leading up to somebody, getting tested. So maybe can you explain what are the symptoms of HIV?
Sure. So HIV is a complicated virus where it does have symptoms at the onset, but it also cannot. It can be asymptomatic. And that's really important to note because a lot of times there are no symptoms, which is why getting tested is so important to do regularly. But if there are symptoms at seroconversion, which is usually when your body starts to shift and the HIV takes over, that would be things like flu-like symptoms like fever, chills, body rashes, night sweats, muscle aches, things like that.
Okay. Thank you for sharing that. Now, I know, again, great advances have been made in HIV prevention, particularly with the introduction of the pre-exposure and post-exposure prophylactics, or PrEP and PEP. So can you maybe explain what PrEP is?
Yes, absolutely. So PrEP is a once a day pill, and it is a medication to prevent HIV. And PrEP is for those who are at high risk for HIV. So whether you are an intravenous drug user, whether you are someone who has men who have sex with men, whether you're someone engaging in high risk sex, or someone who is exposed at work, things like that. So these are all things that put us at higher risk. And when you're at higher risk, you can take this medication once a day, and it helps prevent HIV by 99%, which is incredible. If you're an intravenous drug user, it prevents it by about 74%. There's a little bit less data there, but overall PrEP is an extremely effective intervention at preventing HIV.
So now, who is eligible? I know you mentioned if you're at high risk, but how, if you can clarify, how is that determined in terms of eligibility?
Absolutely. So when I meet with a patient, I typically do a risk assessment with them, and that's just seeing their sexual behaviors, things like that, that would put them at higher risk. So high risk sex typically would be anal sex, especially receptive anal sex, so bottoming, especially condomless sex. So when you're having condomless anal sex, there's a lot of tearing that happens, and it's just a very sensitive lining in the rectum that it exposes you to more blood and fluids. So that's typically the highest transmission rate we see. And then intravenous drugs, if you're sharing needles, things like that, where you don't know what's on the needle or the works that you're using, then that's how it can be transmitted as well. So when I'm talking with someone, if they have a large number of partners and they're having condomless sex, or they're having often, condomless anal sex, or they have a partner who has HIV, those are the people that we're looking for to get on PrEP, because it can help with allowing them to lead a completely normal life while still being protected.
Okay. So then how does PrEP work? Can you explain? We know it's a pill, but how does it help to prevent?
Yeah, so PrEP is a combination of antiretroviral medications in this one pill. And what happens is when you take this regimen for about 7 to 21 days, it takes to reach full effectiveness, it builds up in the body. And what it does is it wraps yourself as a little shield around your CD4 cells, which again are those cells that fight off any viruses, any infections that you have. So it protects those cells so that HIV cannot get into those cells to use them to replicate. Because the way that HIV spreads through the body is it attacks the CD4 cells, and once it's inside them, it makes a bunch of copies of itself, and then the cell bursts and it transports through the body. So what PrEP does is it allows us to protect those cells so the virus can't get into it and replicate.
Okay, thank you. Now, big question, how effective is it?
It is 99% effective when taken as prescribed. Again, that number is lower for IV drug users. It's about 74% effective. And for receptive vaginal sex, there is much less data. For Descovy, there is in fact no data, which is one of the forms of PrEP. So there's still a lot to be researched and studied there. But as far as having anal sex, things like that, it's 99% effective.
Oh, that's great. Now, like you can, do you have to be taking it prior to sex, or like, can you like, oh my God, I just did this, and then get on it and it still be effective?
No, so you need to be taking it before the incident occurs. So that's why we try and see how at risk you are for exposure, because we want to be ahead of it, right? It is a preventive measure. So when we take PrEP, again, it takes 7 to 21 days for it to become fully effective. And from there, it builds up in your body. And that's when it's fully effective at 99%. But we have to abstain from any sexual contact during that time, just to let the medication build up in your system before you can start having sex again.
Okay, thank you for clarifying that. So now we also mentioned PrEP. So how does PrEP differ from PrEP?
So I love this. PrEP is before, like preparing for it. PrEP is after you've been exposed. So for PrEP, it's typically prescribed after someone has an exposure, either via sex or drug use, or even in the workplace, like a needle stick. Healthcare workers, you'll see that a lot. But so once you've been exposed, or you have a feeling that you've been exposed, it has to be taken within 72 hours after the exposure. And what they'll do is they'll prescribe you a 28-day regimen of PrEP. And that way it can combat if you were exposed to HIV and rid the virus from your body before the end of the month.
Okay, great. Thank you. Now, I know for many of the community members you had mentioned earlier, finances are a big challenge. So is there any financial assistance available for those who cannot afford this medication?
Yes, absolutely. PrEP is costly. It comes at a price, I think Descovy has a price tag of $6,000 without insurance for a 3-month supply. So what we do is we offer programs through the manufacturer, like Gilead Advancing Access, which is a card that can cover the cost of copays for your medication and for your appointments. There's those programs directly through the manufacturer, or there's also a program called Ready Set PrEP, and that program covers anyone without insurance or prescription drug coverage. And there is no income limit on that. You can apply for that as long as you don't have prescription coverage. And as far as the Gilead Advancing Access, there is a limit. I believe it's like $60,000 per household. But again, this card helps, cover the cost of the copays, which are often really high.
Thank you. Now, at one time, a diagnosis of HIV, seemed pretty grim to folks, but through advances in treatment, the treatments can help individuals with HIV actually now live long and healthy lives. So can you tell us about the treatment options that are available today?
Yes. So, the treatment has become so modernized, and it's great that it's now no longer this cocktail of medications that you take. Typically it can be in a 1 or 2 pill a day form. And this is antiretroviral therapy. These are part of what make up PrEP. And this is the treatment which works to keep your viral load low and your CD4 cell count high. So it keeps your immune system functioning and suppresses the virus from replicating. And most people typically get the virus under control within 6 months. And when you take this medication, usually it will suppress your viral load so low that you become undetectable. And if the virus is undetectable, that effectively means it's untransmissible. So we often say U equals U. And that is one of our greatest advancements, is that if you take the medication and you are consistent with your regimen, then you can become undetectable, which effectively is untransmissible.
Okay, thank you. So this year's theme for World AIDS Day, set up by the United States Department of Health and Human Services, is Ending the HIV Epidemic, Equitable Access, Everyone's Voice. So tell us about the impact of HIV on racial and ethnic minorities and what efforts the hospital is doing to reach out to those populations.
Yeah, so, HIV disproportionately affects communities of color, and we see that constantly, even communities, LGBTQ communities too, typically marginalized communities. And like I said before, it is no coincidence. It's typically due to structural inequities and systemic racism, poverty, language barriers, things like that. So in order to address these things, what our hospital is doing is, especially at the Siperstein Proud Center, we have an HIV infection specialist on staff. So someone who really has been working in this field and understands how it's evolved over the past 30 years. And then we also have 2 Spanish-speaking staff members so that we can address language barriers. We have a PrEP counselor on staff, so we can provide the prevention efforts and the post-exposure efforts. We also have outreach events in downtown Somerville where we get to meet the community and go be with them and share our resources with them. And we also just are a practice and a hospital that recognizes these inequalities, and we address them by acknowledging them and working to stop them by having all these staff members who are in advocacy positions and working with policy and things like that.
That's great. Thank you so much. That's fantastic. So I would just like at this time to open it up for questions and answers from our audience. If you do have a question for Shayne, you could post it in the Q&A section of our webinar. And Shayne, know why we're waiting to see if anybody posts any questions. I mean, what advice can you give the community, who is sexually active and is potentially at risk for HIV and/or AIDS?
Yeah, so I love this question because I work in sex ed as well as PrEP counseling. And I think that knowledge is power. Knowledge is empowerment when it comes to health. And so really educating yourself about ways that you can help reduce your risk for HIV. So, reaching out to local organizations in your community and finding out, what resources they have to offer. Maybe they offer free condoms. Maybe they offer risk reduction counseling. Maybe they offer free, anonymous, and confidential testing, which is incredible because you can go get tested without any of the fear of being known who you are, things like that, which is typically a barrier for people to getting tested. But educating yourself on ways to be safer and ways to educate others is how we stop the spread, stopping the stigma before it can come out, right? So before people make these judgments or cast these moral judgments on people, educating ourselves that it's a chronic illness, just like any other illness, and we can stop the spread if we know how to stop it by having safer sex behaviors or syringe access programs for drug users.
Thank you. You actually just touched upon another question I just had is like, how do you address those systemic, barriers that you were discussing earlier? And you actually just gave a few examples. I don't know if you have any more, but.
Yeah, I mean, things like syringe access programs are extremely important, especially when we're addressing IV drug users in the community, because they often get pushed to the side, and we focus on the sexual transmission. But syringe access programs allow people to access clean needles so they don't have to share needles. Because again, we're not trying to, tackle everything at once. We can't stop the, drug use and stop this and stop that. So if we're going to address one thing like HIV, well, let's give them clean needles so that way we can stop HIV spread. But also for even our practice, we provide, free transportation for our patients, free Ubers. And that is a huge access barrier typically for our patients to come in. Either they don't have a car or they don't have, the funds and resources to get to our office 3 times a year or however many times it is. And we can supply that because of the grants we have. So we're very thankful to have that and be able to support our patients that way.
Yeah, and I would probably think, right, that even privacy is a concern for individuals. Maybe they might not want to know either, that they are, they need needles or using drugs or, in, having, sex, right? And so I think that's one of the things, to your point, how do you ensure those privacy issues so that you do break down that barrier and enable somebody to get that help in advance?
Yeah, we are a very culturally sensitive office. We are trained to be sensitive to the populations that we work with and the populations that are most at risk. So the minute you walk into our office, we have a very small office, but we are private. We are a closed small space. We have private rooms that close. So when you're meeting with us that you have your privacy, but also that the people you're working with and your healthcare providers are people that understand the needs of this specific population. So when we're all trained in LGBTQ health sensitivity. So we understand how important it is to use the right pronouns, to use the correct name when addressing a patient so they can feel most safe in our office.
That's great. Thank you. That's fantastic. So, well, I don't see any other questions being posted. So if there are no further questions, then I guess this will conclude actually today's webinar. Thank you, Shayne, so much for joining us. We appreciate this enlightening discussion. And again, for our audience, please remember that the opinions expressed here today by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral line at 1-888-724-7123. For more information about the Babs Siperstein Proud Center at Robert Wood Johnson University Hospital, Somerset, please visit www.rwjbh.org/Somerset Proud. So on behalf of Robert Wood Johnson University Hospital, Somerset, thank you everyone for joining us and have a great day.
Thank you, Serena.
Take care.